Hi, everybody. Thank you for joining us. It's 12:01 and we have a full and packed schedule to get through. My name is Katie Taylor. I'm a certified child life specialist here in Austin, Texas. I've been certified for the past 15 years and have worked in hospitals both inside and outside of Texas, and now am the CEO and co-founder of Child Life on Call and also the Child Life Circle, which is a membership for child life specialists to come and get affordable PDUs, but also a place that we can network and share ideas and get curious about growing personally and professionally, which is why we're just very honored to be able to host this conversation. And yes, we also have Cinda McDonald, who is joining us today, who has been the lead, and I'll let her introduce herself and then I'll get to our presentation.
Great. Thank you, Katie. First, I just want to say to you, thank you for offering to host this. This is a really big deal. You are offering to host not only for the Child Life Circle members, but for our extended child life community in Texas and beyond. So I really appreciate that. So I've been a child life specialist for more than 25 years. I am so fortunate to get to lead an amazing team of palliative care child life specialists with Baylor Scott and White. Our hospital-based team exclusively supports children loved by seriously and or terminally ill or injured adult patients across the state of Texas. I've worked in other settings as well, in pediatrics and in community hospice and palliative care as well. I love our field, and I care very deeply about our longevity, which is kind of how this all got started and how we got to the steps up to this point. So I'm going to kind of walk you through what the processes look like and how we have arrived at this point. But I also want to state emphatically, I am presenting the information based on what we have drafted in the recommendation, our work group, our task force efforts, and the proposed details. So just because we wrote these details out and, specifically hoping that the legislature would consider them when drafting a bill, they are not set in stone. And so I just want to be sure that when I sound like I'm speaking in absolute terms, that you understand they're in my absolute terms as far as I know them now. And also we want to have time for Q&A at the end. So I'm going to try to speak as quickly as I can to get through the details, but you also have the details present on the slides. And then Katie has some other information that she'll be able to provide as well. So by the end of this, I hope that you'll have the information and the answers that you need to feel comfortable about signing our petition, if you haven't already done so, and then perhaps even helping us as we continue to move forward.
Yes, absolutely. Thank you so much, Cinda.
Sure.
All right. Is my screen visible to everyone? Yes. Okay, wonderful. And also just to orient you to how this works, we have had and continue to have so many questions. So we'll walk you through what today is going to be like. We have questions that we anticipate. But if you have questions, please leave them in the chat and I'll kind of act as the moderator. I know Cinda has a lot to get through because she wants to walk you through exactly what our journey has been like so far. So there may be questions that I see in the chat and I will acknowledge and we'll save them for the end if they're not going to get asked. And as Cinda says, really our ask today is for you to sign our petition to show your support of licensure for Texas child life specialists. It's not a thing you have to do, but we're hoping by the end of the day you understand a little bit more about why we're asking. We wanted to start off just as we do in the good old child life fashion, is breaking down complex terms in a way that we can understand it, because learning all of this has been quite a learning curve, and I still don't half the time know what we're doing or talking about, but it does help me to come back to this. And that's the three big things that we want to cover today: licensure, certification, and reimbursement. And yes, they all have to do with each other, but they also do not have to do with each other. So very quickly, I know that you can read, but I just want to talk through this. Licensure is a state-issued legal requirement to practice as a CCLS in Texas. So it provides a legal recognition and regulation of the profession, and who oversees it would be the Texas Department of Licensing and Regulation and a state board that has yet to be developed in Texas for child life specialists. Certification, which is what we're all now, is a national credential that we get from the CLCC. It's issued by them. It demonstrates professional knowledge and competency, but does not grant any legal authority to practice. And the CLCC oversees that. And then reimbursement, which we often hear tied to licensure, is when private insurers and Medicaid and or Medicare agree to pay for what would be licensed child life services under specific billing codes. So when you go to the doctor, your doctor submits specific billing codes based on what you're having done, and we would have a billing code when it comes to reimbursement. Licensure does not guarantee reimbursement. That is not connected, and we want to make sure we talk about that today. While it may be a long-term goal, it is not connected to specifically getting licensed. It does allow hospitals and community organizations and providers to seek reimbursement for services. And who oversees that? That would be private insurance companies, Medicaid, and Medicare. So this effort is primarily about licensure, and the Texas legislature could grant licensure, but they could reject reimbursement. And licensure will establish a pathway to advocate for a reimbursement. And we know there's so many questions that are coming up in your brain. So please go ahead and type them in the chat. I see Taylor saying, will the recording be sent to you? I will do my best to remember to send the recording. We will also have an Instagram page. If we can put that in the chat, I'll do that so you can follow along. So we're going to have clips. This is going to be publicly available on YouTube so that you can share it with whoever you would like after. We want to get this information out there. And we're also not hiding anything. We want everybody to know and be able to ask their questions. I'm going to pass it off to Cinda so she can lead us in this conversation, and I will be quiet and moderate on chat and then come back a little bit at the end.
Thank you, Katie. So on this slide, there are lots of terms. What we wanted to highlight is that this is a list of licensed professionals in Texas. So we're in healthcare, so we tend to have tunnel vision about healthcare workers being licensed. But as you can see, there are licensed professionals that aren't healthcare and in a lot of different genres. But as we think through what licensure means, I want to point out that licensure goes hand in hand with public trust, public safety, and professional credibility. So I always go back to the example because I feel like it speaks volumes that eyelash extension technicians are licensed, but certified child life specialists who are supporting children and families through some of life's most difficult, challenging experiences are not licensed. And it is time for that to change. Next slide, please. So for the history of this project, I actually became part of this back in 2022. So I participated in the Texas Health and Human Services Palliative Care Interdisciplinary Advisory Council. From this point on, I will abbreviate that, but I wanted to make sure I stated it here. I was on a subcommittee for pediatric palliative care. So one of their goals was to ensure that CCLSs were part of palliative care and hospice teams in hospitals and in the community. So at that time, we drafted a formal recommendation for the PCIAC legislative report in 2022. That recommendation stated, Texas supportive palliative care teams should include CCLSs as essential members of the healthcare team for both adult and pediatric patients in clinical and community settings. So they also at that time proposed that the legislature fund a study or a pilot program to evaluate the benefits of child life services in palliative care and hospice settings in hopes that it would help justify not only the need, but also the cost to have child life specialists on the teams. Unfortunately, the legislature did not pass that during the session of 2022. So in late 2023, I met with our child life champion, who is Dr. Robert Fine. He's well known in Texas and beyond for clinical ethics and palliative medicine. He has participated in legislature for end of life and advanced directives. In a nutshell, he's the reason that we have our team of palliative care child life specialists at Baylor Scott & White. So I was talking with him about concerns regarding our shrinking field, and I was wondering what ideas he might have as to what we could do to increase our sustainability and our longevity as a field. And his response was short and sweet. He said, we need licensure for certified child life specialists. So I was invited to the last PCIAC meeting of 2023, and that's when Dr. Fine proposed to them that they consider a work group to develop a formal recommendation for CCLS licensure. Next slide, please. So clearly I have never done anything like this before. So I started researching to find out who has and what other disciplines that are aligned or have similarities to child life have participated in this. So I quickly found out that recreation therapist has been making this case on a state-by-state basis for their own licensure. So I researched their governing body. That's the National Council for Therapeutic Recreation Certification. So it's similar to our CLCC, and researched their professional organization, which is the American Therapeutic Recreation Association, similar to our ACLP. And as of 2024, there were 5 states that had achieved licensure for recreational therapy. I contacted the chairman of their task force committee for recreation therapy licensure and loved that he was so generous in providing us with information about their processes and the advocacy they'd gone through in varying states. That really gave us a starting point, a jump off point. So Dr. Fine and I met with the Baylor Scott & White Government Affairs Department, and they voiced that they were very supportive of this effort, but also that they don't have the time to dedicate to help us with it. So at that point, you know, we knew we were on our own to figure it out, which has been good, but also challenging. But I also did want to just make note in saying most of the efforts in this entire process were completed in off hours and on lots and lots of weekends. But we did have some of our work group meetings during work hours, and that was approved. Next slide, please. So in January 2024, the PCIAC appointed 3 supportive palliative care doctors to the subcommittee work group for licensure of Texas certified child life specialists. This is when I felt like we really had a chance, and it started to get exciting that we had these doctors that volunteered to be part of this process and oversight. I was appointed as the subject matter expert on child life services, not licensure and legislature, because I'd participated on the subcommittee back in 2022. I didn't think that I should be the sole voice. So I started reaching out to child life organizations and certified child life specialists in various settings, and it resulted in the creation of our subcommittee work group. The work group in brevity was tasked with writing the formal recommendation to submit to the PCIAC for approval and support. So we had an outstanding liaison in Erica Dolly. She worked with Health and Human Services. She was assigned to us to help in the creation and formatting of the formal recommendation. And in preparing for today's presentation, I went back and looked at how many versions we went through before we got to the final version, and there were 31 versions. So you can imagine this was quite a process. Throughout 2024, we collaborated as a work group and with the oversight from the physicians. We collaborated on verbiage and on the details until we reached a consensus. This was a group effort comprised of CCLSs and the overseeing physicians and Erica from Health and Human Services. We were invited to speak our case to the PCIAC committee, and after 3 presentations during the year, in November 2024, the formal recommendation was approved. The recommendation states that, number 1, the Texas legislature should establish licensing requirements for child life specialists in both adult and pediatric settings, in hospitals and within the community that fall within the scope of support for child life specialists. There's also a subtext there that speaks to a basic license and additional specialized designation licenses, which is very hard to say. So I'm going to call those basic and SD licenses from this point. We'll talk more about that. And then number 2 in the recommendation was that Texas Medicaid and other commercial insurance payors should provide reimbursement for licensed CCLS services in all settings, including for services provided via telemedicine. I did provide Katie with an abbreviated version of that 17-page document, and then she's going to have that available to share. Next slide, please. So while we thought that we got through the hardest part, we were far from correct in that. We are currently working on the hardest part. We need the Texas legislature to draft, file, vote on, approve, and then have the governor sign a formal bill that will become a law, the Texas Child Life Specialist Practice Act. So in this process to where we are now, we confirmed 3 supportive palliative care physicians who all agreed to be champions for this effort. So with that comes the understanding they may need to serve as witnesses and testify to the House, the Senate, or both on why licensure for Texas CCLS is the right thing to do. And so backing up a bit to mid-November 2024, after the legislators were voted in following the big votes, I began mailing letters through snail mail to Texas legislatures they were identified to me as having the potential interest to support this effort. So I followed letters with emails through their capital portals, and then to direct email addresses that were provided to me by one of our endorsers, and that's Chris Kulak with the Texas Visiting Nurses Association. So he has some of the insight and info that I couldn't access. I emailed and called representatives and senators, as well as their staffers that included policy analysts, chief of staff, legislative directors, and any other email addresses that I could identify, for a total of 27 legislative offices. From all of those efforts, we received 5 responses, and that's 5 in total from all the mail, emails, phone calls. Those 5 responses resulted in 3 meetings with legislative staffers. And when I say meetings, I mean they gave me 15 to 20 minutes to present the case, and then they asked me follow-up questions and then asked me to provide additional information by email. From those meetings, 2 senators agreed to solicit a draft bill on the formal PCIAC recommendation that we wrote. And only 1 senator needs to submit that. So 1 senator submitted the verbiage for that first draft and agreed to file the bill as well. And that's a huge accomplishment in that. So I have been calling that senator's office basically every day since we found that out, which was about almost 2 weeks ago that we found out that it had actually been submitted. They have not yet received the first draft bill, so our task force is awaiting that as well. Next slide, please. So at this point, I told you about the abbreviated PCIA recommendation that Katie will be able to provide. So that will give you more of the details instead of me reading all of that to you up to this point. But we need support in the form of letters from providers and medical staff, validating their support for our efforts and for the essential nature of our role, which we are all clear on, and we know that many of our supporters are, but we need it in writing to help us. And then Katie, did I provide you with a sample letter as well? That kind of a template for providers that they could follow.
You did. Let me look at my email as you're chatting and see if I can find it and bring it up.
Okay, because that could be helpful just to kind of give you some outline of what we would hope a letter might contain. So we also need letters of support from patients and families, and so those aren't going to be letters of families saying we agree that child life specialists should be licensed. I mean, it can be, but it doesn't need to be. But what we're really hoping for is to highlight the value and the benefit that they've received from their experiences with child life. So, and we are, as we go forward, we are basically sitting on go for the next steps. So that is where the next steps include where the draft bill is sitting. So we need it completed. We need a bill officially filed. And then after that, we're going to seek to nail down a date and time to actually testify to the Senate, then possibly the House, or maybe even both houses. And for that, then we'll need people who are willing to testify. So I'm just kind of putting these little nuggets in your thoughts now, so as something you might be interested in helping with. But the biggest ask we have as of today is we need signatures on our petitions. We have 2 petitions. One is specifically for Texas CCLSs to sign, and the other one is specifically for supporters to sign. So the supporters can be CCLSs from other states, patients, families, providers, staff, anyone else in support of it. So I checked the petitions this morning at 10:45, and at that time we had 193 signatures on the Texas CCLS petition and 272 on the supporters petition. So we need to boost those numbers, but especially need to try to boost the Texas CCLS one, because it would be so beneficial if we could have at least 300 signatures on that one, since that would be about 1/2 of our field in Texas. So again, just throwing it out there again, we sincerely hope that after this, you will have the information and the answers that you need to help you feel comfortable in signing the petitions. So next slide, Katie, when you're ready.
Thank you. Bear with me for a second. Technical difficulties. All right, coming back to the slides.
Yep, there we go. Okay. So I'm going to start moving through these a little quicker because I want to touch on some of the highlights. So I realize there are pros and cons to licensure. Pros include recognition and standardization of our role as healthcare providers and in our practice. Our reason for pursuing licensure is first and foremost about protecting the public. We know the shortage of CCLSs is wreaking havoc on hospitals and healthcare settings. And I personally have seen job posts for child life specialists that specifically state certification is not required. So this is not the same as them saying certification eligible, but you don't have to be certified when you start. This is saying you do not need certification. So under that same job description, the assumption comes that they may also not need to be certification eligible in any capacity, including internship, degrees, training, and otherwise. So it basically means they can hire someone who is not at all competent, vetted out as a qualified child life specialist to fill a job, and that is not okay. And I think that would be something I can imagine all of you would agree to. We believe, and the legislative staffers that I've met with also believe that licensure will likely increase opportunities for CCLSs in Texas. So Texas has the second highest number of CCLSs, only second to California. Licensure could create more pathways to CCLSs for jobs, and therefore could also increase interest in coming to Texas. I mean, we are proud of Texas. We would love to have more child life specialists here, but we also would love for this to be an incentive to be here. Licensure will serve as an advocacy tool to validate that we are essential healthcare team members, and that can also serve to increase market value. So both of those combined could have a very positive effect on salaries. Next slide, please. Cons of licensure, excuse me. It is state specific. So as opposed to certification, which is national and even international, states have to pursue licensure individually. So while Texas may agree to many of the details of the licensure that we're hoping for, it will likely look different in any state. But we do, this is how the process begins. And we know that we want to make sure we have a say in it. We would like for other states to also begin the process when they're ready, but just reminding people that it's going to look different based on, how you get started. But there's got to be the standard of a bill that becomes a law for licensure to take place. With licensure comes some additional costs, including fees for licenses, basic and specialized licenses, and the additional continuing education requirements. And then, like I mentioned, licensure does not guarantee reimbursement. Even if the legislature approved licensure and the ability to seek reimbursement, it is still up to the hospitals and insurance providers to determine reimbursement policies. Next slide, please. So the number one question we've had was about families and how they'll be impacted if reimbursement is approved. So will families be turned away if they can't pay for child life services? No. From all the research we've done and from what we've learned, I was not aware that there are lump fees in hospital billing, fees that either don't already have reimbursement options or the hassle of breaking down those services is just too much. So they lump the services together. So these services include, even bedside nursing, social work, pastoral care, bedside techs, and then many more services. So families are not denied these services if they don't have insurance, Medicaid, or the ability to pay cash. This is a standard part of care in the hospital setting. And if the option for reimbursement passes, it's still going to be the responsibility of hospitals and community organizations like palliative care and hospice agencies and community CCLSs to determine how they want to proceed with reimbursement. And if approved, it will be up to those private insurers to determine if and what child life services will be reimbursed for. Next slide. So will this impact salaries? Like I told you when we started, I would love to 100% guarantee that it will, but I cannot say 100% certainty that it will, but we believe the chance and the hope for it to increase salaries is strong. So we hope it will, but it isn't likely to be an immediate process. Hospitals still have their own steps to determine salaries, but adding in the licensure component will most likely help them understand the higher value of child life services and lead to higher salaries. Licensure will certainly grant us all the ability to better advocate for higher salaries for ourselves and for our programs. Next slide, please. So here are the requirements. And like I said, you can go back and review these more in detail. I'm just going to breeze through them here. You have to meet the requirements for certification, and you must be certified as a child life specialist before you can be licensed and to keep your license. You must have a minimum of 4,000 hours, which is the same hour requirement for internship supervisors. You must pass a background check, be fingerprinted, and not be listed in any state registries like sex offender registries. And for CCLSs who are currently certified, we anticipate that, I'm going to say when this law goes through in September, that you will be grandfathered in if you're already certified and licensure passes. Next slide, please. Our work group will not determine the fees. Those fees will be determined by the TDLR. We have included estimations of what those fees might look like based on other Texas licensed professionals. This slide shows insight about fees for basic and specialized licenses, as well as renewal fees. And I'm going fast, but y'all have time to come back to that. Next slide. So this slide talks about options to put your license on inactive status. So that means you don't have to give it up. You just also don't have to pay fees and keep up with CE to maintain it. It also talks about a reactivation process and late fees. Next slide, please. So this gives kind of an overview of the specialized licenses and the requirements to hold one or more, as well as a current list of the specialized license options. We included a statement here that other SD licenses may be added in the future, but I think what really is exciting about having specialized designation licenses, it really gets to highlight your expertise. And I know most child life specialists, pursue additional education in the work for their populations. So I think this is just a great way to highlight that by having a specialized license. So next slide, please. So what happens if I'm a Texas certified child life specialist and licensure passes? Licensure is different from certification, but a Texas CCLS will be required to maintain both. There will not be an additional exam for licensure, so I'm sure that puts a lot of people in relief, just that alone. When this bill is passed, it will become a law, so Texas will mandate that CCLSs must be licensed to practice in the state of Texas. This is a good thing. It ensures that our CCLSs meet state regulations. There is no guarantee of reimbursement for the reasons we've already talked about. Having SD licenses will recognize the efforts for growth and advancement in the field, and therefore shine the light on individuals' expertise in focused areas. Licensing fees will go to sustain the licensure processes. There isn't going to be anybody profiting from licensure fees. It also will include the oversight of continuing education and disciplinary oversight from a state board as well. Next slide. So, what are you signing if you sign the petition? Your signature is not committing you to anything regarding licensure. It's not obligating you to participate in the legislative process, but it does show that you agree that certified child life specialists in Texas should be licensed healthcare professionals. you aren't required to sign, but we really do hope you will sign. We really want as many voices heard as possible, and this is one way to do that. Next slide.
Forgive me for
Oh,
a sec as I try to make this bigger again. Sorry, guys.
you're navigating a lot, so you're fine.
Okay. I'm going to come back here to present, presenter view, present. Helps if I talk to myself. And then come down here. And just a little follow-up for now in the chat, in case you're not seeing it, I have given both the petitions to sign if you are a Texas certified child life specialist and you would like to sign the petition. Also, if you are a child life specialist or a supporter of child life outside of being a Texas CCLS, so if you work in Georgia or Virginia or California and you want to help support our efforts, I've attached that petition. You'll also see in the files of the chat an abbreviated version of our drafted bill. And you're also going to see a drafted letter to ask for support for this.
Thank you. So what can you do to help? You can spread the word. You can encourage people to sign the petitions, encourage your colleagues, encourage supporters, send in letters of support from providers and staff, as well as from patients and families who benefited from child life services. Complete the Google form. Do you have the Google form link, Katie? Sorry, I keep throwing these things at you.
And I'll put that one in the chat as well.
Okay, so the Google form link is just something you could submit to kind of stay up to date about ways that you can help and about ways about the things that we're doing. We're updating it as often as possible, so it's not a weekly update, but when big things happen, we try to send that out. And then when we give the go ahead, you can join our actions. You can consider a trip to the Capitol if we need to move forward with that. You can participate in letter writing campaigns. And when we say go, you can connect with your personal state representatives asking for their sponsorship and vote on this bill. Next slide.
Also, just adding here, we also have an Instagram page for Texas CCLS licensure, which we will post snippets of this conversation and more updates as they come.
Perfect. Okay, take a breath.
We did it. Take a breath.
Information in a short time. So, yeah, I just want to open it to as many questions as possible. And Katie, if you have any other things that you want to speak to.
I want to come back to we were getting some questions about getting grandfathered in, all of that, and what the 4,000 hours was for. You're going to see all of that explained in the abbreviated version of our drafted bill, which I have in here. But we really came together after hours of on this workforce committee with Erica Dolly, who is from Health and Human Services, getting input from what rec therapists have done, modeling a lot after what the ACLP has done. And so pretty much all of it aligned with what you have to do to become certified, in addition to having those 4,000 hours, which we modeled after what is required to become an internship supervisor, that you need to be in the field. If you're grandfathered in, you already have 4,000 hours, you can get grandfathered into being licensed. And then had the great advice to add what else is required for like registered nurses who are licensed and licensed doctors about child sex trafficking, being mandated reporters. And so adding that on top of our licensure. Anything else that I'm missing, Cinda, or that anybody has questions about?
I can't think of anything you're missing, but definitely questions would be.
Yeah, and like a background check, fingerprinted, those things aren't necessary to be certified.
Right.
Trying to see what other questions. So I'm hearing, what CCLS work in Texas before they have 4,000 hours? That's a great question, Cinda. How would you hire as a child life specialist who doesn't yet have 4,000 hours but isn't licensed? How would you handle that?
I think that's a very standard process. In the rec therapy, especially, they have to have I think they have to have 2 years. And I believe they narrowed it to 4,000 hours similarly before being licensed. So just like you can work now without being certified, but with the expectation that you will be certified in a certain period of time. That would be the same with licensure. So you can definitely be hired and work as a CCLS, just not as a licensed CCLS until you have that 4,000 hours. And all of the 4,000 hours doesn't have to be from Texas. So it could be from outside of the state.
Yeah, I hope that answers your question, Brielle. And we really modeled this after what other professions are doing in social work, licensed marriage, family therapists, rec therapists. So it's essentially your first 2 years, your entry into the field before you can become licensed.
Right. Good question, though.
Great questions. I've been trying to keep up in the chat. Does anybody else have any others that you're thinking about?
It's a lot. We went fast.
We did. We did. What is the CEU requirement? And so something to note, the lingo typically in child life is PDU, Professional Development Unit. I don't know if that would change officially over to CEU since that's more of a common continuing education to maintain your licensure. I forget what we said about what we have it in the bill, but what was it, Cinda? What was our CEU requirement?
It's a minimum of 24 CEUs per licensure period. So every 2 years. And then for specialized licenses, if you apply for one in addition to the basic licensure, then 12 of those hours have to be towards focus on that specific specialized area. And then there would be additional CE requirements if you want to have additional specialized licensure. So what I thought was interesting, we did model this, like Katie said, aligning with other healthcare professionals, but also if you look at, a span of 10 years, so that's 2 certification periods, the CE requirements are the same. So it just seems more because it's pushing it to every 2 years, but we're not putting an undue amount of CEU requirements. And again, this wasn't just something we flippantly came up with. It was after a lot of research.
Yeah, some great questions are coming in. One is from Sherwood. Hi, Sherwood. What is the overall feeling about this among CCLS? Are most CCLS in Texas on board?
Well, that's a good question. We do have 193 that say yes, out of what we believe are 605 at last count of certified CCLS or CCLSs in Texas. And we've had a lot of positive feedback. I've had people offline messaging saying that they're really excited and hope that this does pass. So I would assume that probably most people unsure or not fully in support at this point, it's probably likely due to questions that they have. So our hope was that having this Q&A would get those answers out there as much as possible, and hopefully sway those people that may be on the fence because they didn't have those answers to now have the answers and also be in support.
Yeah, great. And our door is always open. We want to answer those questions. We have developed this drafted bill, which Cinda talked about at the beginning, all that she has gone through and we have gone through as a team, and going over so many different scenarios, and have really had great conversations about this from child life specialists in the community and also in the hospitals. So we looked at child life specialists working in private practice. Those have been directors, tenured. We're looking all over the map, and are really opening up this space to ask you all that question too. What is your general feeling and consensus? What are your fears? What can we talk about now? Has the ACLP weighed in on this initiative, and would they be into support?
I reached out to them. I had a meeting with Sarah Patterson and Alana Brewer, specifically about the licensure piece. I have, prior to that, reached out to the ACLP 3 times and never heard from them in response to my specific questions about their support. When I met with the task force committee leader for the therapeutic rec specialist, they have written verbiage from their governing body and from their professional organizations that speaks to licensure, but because just like with us, it's a state by state process, they can't participate actively, but they are fully supported it, including giving task force and committee time to those efforts, through their governing body organization and their professional organization. So I think, so I'm losing my train of thought of where I was going with that, but with the ACLP. But in speaking with Sarah Patterson and Alana Brewer, they said that just like what we've heard, the ACLP can't formally come out and help with this, but that she was taking back to them the question that I've asked and posed 3 times, to ask them to come up with the verbiage that we can universally use throughout all the states should they apply for the similar licensure. That would be kind of the standard for where we start. So my hope is that that would be the next move from ACLP, but they have not, like I said, formally responded to that piece. But Sarah Patterson did feel that that would be something they could come up with. We do have the endorsement of the Southern Association of Child Life Professionals. After meeting with them, their board in 2 meetings, and they decided to fully endorse this.
Yep. Also reached out to community organizations like Child Life on Call, the Child Life Circle, Hearts Connected, Wonders and Worries, which have all shown their support. Jennifer, hi, I see your hand raised. May we hear your beautiful voice or possibly even see your face. Please don't everybody feel afraid to come on and let's make it a group.
Lunch at the same time.
Okay.
I had but it was too long to type. But and y'all may have said this and I missed it because somebody came into my office. But I hire a lot of people from out of this state. Has there been any concern or worry that then people won't want to move to Texas because now they'll have to pay for the licensure, you'll still have to keep up your certification dues, right? Fees, all the things. I know the last several years, a lot of people we've had a lot of issues with people complaining about salary or having to pay too much at the ACLP and all that stuff. Has any of that come up as questions, concerns, worries when it comes to this? I know I have a lot of newer staff, and so that is a real kind of question that a lot of them have brought up as well.
I have not personally had anyone ask that question as far as, is it going to become a problem with hiring from out of state? And the legislative staffers that I spoke to actually said they feel that it will increase the opportunities and hopefully drive more employment into the state because it is a higher credential than certification. So we talked about why, that is a con, is that there have to be fees associated with it. And that's not something we have any control over. But we're hoping that with the hopeful increase in salaries, the increase in professional credibility and standardization of practice, that people will see it as a worthwhile cause. But that's a good question. I have not received that. Katie, have you had that question to you?
I haven't had it yet, but it makes sense. As a low paid field, we're always asking about what extra fees do we have to do. It's one of those things that just kind of comes with maintaining either a certification or a licensure, whether you're a nail technician or a licensed marriage family therapist. So there are fees for maintaining, and understand that it's difficult, especially as you're entering the field. I actually was just meeting with a friend last week who's a licensed marriage and family therapist who has to receive weekly clinical supervision once a week at $400 a month, completely out of her pocket to maintain her licensure. So I always like to bring up those things that say other professions that we're looking to are doing things that are way, way more expensive and harder to maintain. This is, I don't want to say the lowest hanging fruit, but pretty much modeled exactly after certification, with dues that we have to pay so we can maintain our licensure, with a couple of extra things like the 4,000 hours, the licensing or the sex trafficking and mandated reporter.
And those 2 courses are free.
Yeah. Great question though, Jennifer. Thank you so much. Sherwood said, this is something so many people have been interested in for some time. So thank you for diving into it and really exploring what it may look like for our field. And I want to echo that and say thank you so much, Cinda. The countless unpaid hours. Let's talk about the amount of value that she has put into this is just incredible. And like she said, it really did fall into her lap, something we really needed to pursue. It opened up for her. And so now we're taking input from all of you.
And
Shannon,
Katie, if I can just say something
sure.
quickly too, in regards to the fees associated. I know in our program, we cover certification fees through our budget. So my hope, I don't know if all other programs do that, but if that's something they do or isn't something they do currently, but could be encouraged. Same with licensure, because I know with Baylor Scott and White and probably with most healthcare systems, physicians' licenses are covered as well. And I only know from my husband being a dentist, his renewal license is $350. So their physician licenses are likely much more expensive than this. And my hope would be that programs and individuals can advocate for that to be covered, especially since it would be a law.
Shannon has a great question that I don't know the answer to. Does the Texas legislature have the ability or authority to adjust these requirements for licensure?
I believe they do, but I think they would take into account the recommendation that was developed through the PCIAC, because they don't have the subject matter experts in the legislature as far as the legislatures, the staffers. So they could ask for changes or encourage changes as well as before a final draft. And that would be something we would have to look at as well. But I don't, as far as a lot of the specifics, I don't anticipate there would be changes.
Brielle says, would the CEUs we take and utilize for certification qualify for licensure, or do we need different ones?
No, they would.
Yep, they would qualify. And we would look at those to get your SD license, your special designation. If you really have 10 in palliative care or 10 in oncology, that's how you would be able to apply to get the special designation license.
It's 12, but
12, thank you.
Yes.
Another question that I don't know I totally understand. Do you need a child life state board or just the Texas Department of Licensing and Regulation to monitor those who are licensed?
We would have a state board, and that would be comprised of certified child life specialists, licensed certified child life specialists. I don't know the process for how many people have to be on it. Based on, I'm also a dental hygienist and have a license in dental hygiene. I know that their board is dental hygienists. So they would have a board made up of people that are already licensed in the field, but I don't know like term limits and that type of thing. I don't know what that would look like, but there would be something in place. And also I just learned recently that they have in this session are trying to pass a certified CEU monitoring system that's, like kind of an automatic thing where you upload, what you have completed and it's monitoring for you. So they don't have to have people putting in the effort to double check and make sure you have all your CEUs. So hopefully that will pass and that'll make things a lot easier.
Yeah. A lot of learning as we're going along with not a lot to look at. And if you are from another state, we really want to thank you for joining and just supporting us and asking the questions. Cinda has done so much to pave the way. Jenny, what do you mean by that would be across professions? Help me understand what I think it would be for the CEU system. I think you were speaking to your dental hygienist system, right?
No, I think it's going to be across the profession. So
Okay,
like anybody who's required to have CEUs, they're going to have some kind of monitoring system in place, which I think would be great if they can do that.
Yes, awesome. Kelly says, have any other states been successful in getting licensure approved?
No. California had a bill passed, and I'm speaking from memory, but I think it was regards to child life specialists being able to be reimbursed for support provided outside of the hospital for trauma. I think there was a vetting process that they had to go through with a certain number of hours of and years of experience, and I think other things that they had to actually apply to be able to do that. But that is not licensure. But it's a good step forward to show, you know, the significance and impact that child life specialists can make. So we would be the first.
Great. Any other questions? I know we're getting about 10 minutes. Please scroll up in the chat, and then if you did not receive an invitation to this Zoom meeting and you just hopped on from somebody sharing it, please put your email in the chat so that I can follow up with these slides, a link to the YouTube video, which will be publicly available, and all of the different forms and way to support. Katie, I have it up here and I will include it in the email too. Just make sure that I have your email. And she's asking for the form to submit, and you really just send it to us and we include it if a family wants to provide any input on the impact. Let me put our email up here so you can see it. So we are cclstexaslicensure@gmail.com. So any questions you have, you missed a specific form, you didn't get my follow-up email, email this and we'll have it all.
And then remember, when you send those in, especially questions, that we are a tiny group of people that are working and trying to respond to them. So we will respond as quickly as we can.
Yep. All right. Thank you all so much. Thank you, Kelsey, Lindsay, Katie, Jenny, Kelly, everybody for your questions. Brielle says thank you. Has a flyer, anything been created to share with patients and families about impactful stories that we can utilize to spread the word? You know, we've made a lot of things. I don't think we've made that yet.
We haven't. That's a great idea.
Yeah. All right, Brielle, can you make it for me? Just kidding.
Yeah, we have a one-pager that Katie developed for us, and that was for legislators and specifically. So that's a great idea. And even, you know, with some editing, that could be for providers as well.
Cinda, do you want to talk a little bit about the timeline and why we tried to get this meeting in on March 4th?
Yes, sure. So March 14th is the deadline for a bill to be filed. So all along I was going, okay, we have until June to make this happen. No, we don't. We have until March 14th to have the bill actually filed by the senator. And I have specifically not included the senator's name because I want to make sure we're not bombarding that office with letters before we have an actual bill, a formal bill. So as long as it's filed by the 14th, then we have a shot at this going forward. So from there, it has to be voted on in the Senate twice. Then it goes to the House and has to be voted on twice. I don't know why they do the twice thing, but in the Senate, it usually happens on the same day. And in the House, it doesn't usually happen on the same day. So as soon as we know a bill is filed, then, we advocate for a date and time for witness testimony. And that's when we need people most likely to go to the Capitol to give a 2-minute testimony on this. I got to sit watch some that's happened with another committee. So it's I just wanted to see what that looked like. And it is 2 minutes. So then if it all continues to pass forward, when the session ends in June, and I cannot remember that date specifically, but it's in the early June. When the session is done, then all the bills go to the governor, and the governor can sign them, sit on them without signing them, or veto them. So if he signs it or sits on it without signing it, it becomes law. If vetoed, obviously it doesn't. But if it becomes law, it's effective this September. I mean, it goes in that quickly. So it's possible that by the 1st of September, or I think that's the date, but I believe the 1st of September, that we could actually have licensure.
It's also possible that we don't actually get this bill done this time, and then we have to wait another 2 years.
2 years, yes. That is the bummer of this, because the session is in, the legislative session is only every 2 years for 6 months unless they have emergency sessions. And I don't know that if they have an emergency session that we would be able to get the bill in again. So it would probably be 2 more years. That's why we have the started in 2022. Now it's 2024. So my fingers and all hopes are crossed that it would actually happen this year, but it is possible that it won't happen. I'm having trouble saying that, Katie, because I want it to happen.
Yeah, it's going to happen. And does anybody else just keep thinking of the Friends episode when Chandler says, and that's how a bill becomes a law?
Yeah. Well,
Oh.
I'm much older than y'all, and so mine comes to Saturday morning Schoolhouse Rock. If you don't know what I'm referring to, you can look up Schoolhouse Rock, how law becomes a bill. I mean, how bill becomes a law.
True facts. We've sent each other cartoons on how this all works.
Yes. And I actually had to read the kids' guide to legislature, Texas legislature, to understand what the process looks like. So, and it was very helpful.
Great. Well, thank you all so much for your questions. Any show of support by signing the petition and telling your coworkers about it are just so incredibly helpful for us. Maddie says thank you. Lauren's giving fun facts to me about cosmetology operator licenses, which we'll save for another time. Awesome. I'm going to read this really quickly. Okay, somebody is offering, let me talk offline to you and then we can chat after. So I think I have your email, Lauren. Jennifer Rody, thank you so much for coming and being such a voice for leadership and asking those questions.
Yes, I appreciate everybody's participation. This is exciting, scary, all the things above, but it's a good way to help us move forward.
Awesome. Thank you, everybody. Have a great rest of your day.
Thank you.